So our drug was Midodrine, and this is by Abigail Cantrell, Lauren Bennett, and Gursimran Pabla. So Midodrine, the generic name is Midodrine, and some brand names are Arvatin and Proamotine. Um, the classification is that it's an alpha adrenergic agonist. It stimulates the nerve endings, which causes blood vessels to tighten and thus increases the blood pressure. And the drug pregnancy category is a C, which means that animal reproduction studies have shown an adverse effect on the fetus. So, some understanding of midodrine, the mechanism of action, um, the activation of alpha 1 adrenergic receptors signaling pathways lead to an increase in the vascular tone and elevation of blood pressure. In other words, it just stimulates the nerve. The therapeutic use is the treatment of low blood pressure or hypotension. The dosage is typically about 10 milligrams, and you'll find them in tablets. So, for example, on your right, you'll see a 5 milligram tablet. So, if your dosage was 10 milligrams, you would take two of those. The route is PO, like I said, the tablet, and it's every 8 hours typically. The half life is about 3 to 4 hours. Peak plasma protein concentration occurs about 30 minutes after administration of the drug. The main ingredient is midodrine hydrochloride, and this can be taken with or without food. And then just some adverse effects that's good to know is hypertension if you give too much. You'll know this by some pounding in the ears or blurred vision. Other side effects would be dysuria, goosebumps, or an itchy scalp.
So the pharmacokinetics for midodrine is, pharmacokinetics is how a drug is absorbed, distributed, metabolized, and excreted. So every drug has their own pharmacokinetics, but with this drug specifically, it's absorbed, it's administered orally, and due to that, some drugs you're not allowed to take with food, but with midodrine, it's not affected by food. Um, it doesn't diffuse properly over the blood brain barrier, which means that it doesn't have any major effects with the central nervous system, so you don't have to worry about adverse effects with that. And then its bioavailability is 93%, which means that 93% of the drug will be absorbed and used in its active form, which is pretty normal for a drug. And the peak plasma concentrations are reached 30 minutes after drug administration. And so it's a pretty fast acting drug. It is metabolized in the liver, and there's an enzyme on the liver that's the CYP2D6 enzyme, and it's used to metabolize the drug. And that enzyme specifically is known for rapidly metabolizing medications, and that is why it is at its peak levels in about 30 minutes. Due to the fact that it is a blood pressure medication, it is distributed throughout the various tissues and the vascular system. And so there isn't one specific organ or system that it just works on. It works with the vascular system. And like most drugs, it's eliminated by the kidneys and it excreted renally, renal elimination. And so yeah, that's the pharmacokinetics. Just a brief intermission. No worries. All right. So then with the pharmacodynamics and genetics, there is a saying that says that within 1 hour, your systolic blood pressure will be elevated by approximately 15 to 30. And then after a 10 milligram dose. And then that effect will can be persistent for the next 2 to 3 hours. So it's good for orthostatic hypertension, due to the fact that the effects are long lasting. And so pharmacodynamics is how the drug affects the body and also the mechanism of action. And so Midodrine, it is used to increase the systolic and diastolic blood pressure for patients with, like I said, orthostatic hypotension. And the mechanism of action is that Midodrine undergoes metabolism to form its active metabolite, which is the desglymidodrine. And the desglymidodrine activates the alpha-1 adrenergic receptors in the venous and arterial vasculature. And so that means that it works on smooth muscles and not others. It produces an increase in vascular tone and elevation of blood pressure, which just means that it causes vasoconstriction and therefore higher blood pressure when the patient stands. Midodrine does not stimulate cardiac beta adrenergic receptors, which means that it does not work on the heart, and it simply just works on the vasculature system. So it can be more widespread throughout the body, and it doesn't affect the way the heart works. And then with the pharmacogenetics, it's just how every person's body works differently. And so with this drug, due to the fact that it is simply just a blood pressure medication, most people have the CYP2D6 enzyme on their liver, so it doesn't really affect. Most people have the same effect from the drug due to the fact that it's the enzyme that's working. So if the enzyme does not work, then that person's more susceptible to have adverse effects with this drug. So yeah. So then for my question, I said, which of the following are true about mechanism of action for Midodrine? And the correct answer is C, due to the fact that Midodrine acts on the CYP2D6 enzyme on the liver, and it is used throughout the vasculature system to increase blood pressure. The other ones are not correct because it is a fast-acting medication, so it would not see its peak in 2 hours. It would see its peak in 30 minutes. And then it does not use the receptors on the heart. It uses the receptors on the vasculature system and the smooth muscles, so it doesn't activate the heart. And then it causes vasoconstriction, not vasodilation, to increase the blood flow in the body, and that therefore increasing your blood pressure.
Okay, moving on to the responses, physiological responses of Midodrine. As we've said, it activates alpha-1 adrenergic receptors and increases the vascular tone and elevates your blood pressure. Basically just causing your blood vessels to tighten and increasing blood pressure. Midodrine hydrochloride, which is how the medication is usually prescribed. It's contraindicated in patients with severe heart disease, acute renal disease, urinary retention, pheochromocytoma, or hypothyroidism. Pheochromocytoma is a tumor on the kidneys, and hyperthyroidism is when the thyroid gland is producing too much thyroid hormone. Midodrine can also cause supine hypertension, which means you have high blood pressure that occurs when you're laying flat on your back. Some developmental responses to Midodrine. The medicine has not been shown to cause side effects or problems in the pediatric population. However, it hasn't been adequately tested, so it's not recommended for the pediatric population, and it also has not been adequately tested for infants, so it is not recommended to take while you're pregnant or breastfeeding. However, for the geriatric population, it has been tested pretty thoroughly and hasn't been shown to cause any side effects or problems in older people than it does in younger adults. There are no psychological responses specifically for Midodrine. However, they should not stop Midodrine abruptly due to possible withdrawal symptoms. Some beta blockers can cause withdrawal symptoms, and even though beta blockers are antihypertensive, all blood pressure medication should be consulted with a physician before stopping. So it's really important to talk to your healthcare provider before stopping any type of blood pressure medication. They can help you determine whether it's safe to stop, and if you do need to stop it, they can give you a plan of how to lower it slowly. Some socioeconomic responses. Midodrine is pretty affordable when you use your insurance or certain coupons. Usually you can find it for about between $20 to $30 per prescription. The average retail price is in the 100s, but normally you're able to find it in a reasonable price. Some cultural and spiritual responses. You can try many methods to treat hypotension. A lot of lifestyle changes include wearing waist-high compression stockings that can help improve blood flow and reduce symptoms of hypotension. Getting up slowly, drinking plenty of fluids, and increasing salt in your diet. Another interesting response to Midodrine is that in 2010, the FDA considered withdrawing due to the lack of post-approval studies that verify safety and effectiveness. So Midodrine was marketed as proamtine, and it was approved in 1996 under the FDA's accelerated approval regulations for drugs that treat serious or life-threatening diseases. However, the FDA threatened to remove this drug from the market because there was no post-marketing studies that had been conducted in order to prove the efficacy of the medication. But after further examination, they decided to keep the drug on the market. And below, there's a photo there that shows a warning that is printed on every label of Midodrine. Some health inequities for taking Midodrine. In age, it can be used in patients 18 and older, as long as they don't have any other health contraindications. The medicine has been tested in only a limited number of children, 6 months to 12 years. So the safety and effectiveness in children has not been established. For gender, there's no known differences in efficacy regarding that. And for race and ethnicity, there's also no known differences. However, seeing that hypertension has the highest prevalence in African Americans, it makes it highly contraindication for this population to take Midodrine if they do have hypertension. And then our second question is, Midodrine is contraindicated in all of the following except, and the answer for this is B, a 45-year-old male who's taking ibuprofen. There's no known drug interactions between ibuprofen and Midodrine. A would not be the correct answer because the most potentially severe adverse reaction associated with Midodrine is supine hypertension, which again is when you have high blood pressure while laying down. Supine hypertension, if sustained, can cause stroke, myocardial infarction, congestive heart failure, renal insufficiency, or similar disorders that can be fatal. The answer would also not be C because digoxin treats hypertension and Midodrine treats hypotension. So when you use it together, it can cause extreme bradycardia or AV block. And it would also not really make sense to be treating both hypotension and hypertension. And D is also not the correct answer because this patient has difficulty urinating. Midodrine can increase the tone within your bladder and can cause urinary retention. So it should be used with caution in patients that have urinary tract flow obstruction or any difficulty urinating, because since Midodrine is eliminated by the kidneys, accumulation can occur. And monitoring the effectiveness of Midodrine, You're mainly going to monitor effectiveness through lab testing, so monitoring both supine and sitting or standing blood pressures in order to compare, because a lot of the time Midodrine is used to treat orthostatic hypotension. And so it's really important to monitor their supine and standing blood pressure regularly and to stop the drug with caution if the BP is increasing excessively. And then this is also something that you would determine acceptable parameters with your healthcare provider. Other lab tests include your renal and hepatic functions prior to starting Midodrine and throughout your Midodrine therapy. You don't normally use radiology to measure effectiveness of Midodrine. Some telehealth things that patients can do is just reporting to their physician any extreme side effects, especially associated with supine hypertension, which would be things like pounding in your ears, headaches, blurred vision, and the sensation or awareness of your heart beating.
So in a conjunction to that, you want to apply anything to go along with the scope of practice. So it's just knowing who gives the drug, who orders the drug, who gives you education on the drug. So the provider is going to order the drug. And then the pharmacist is really important because he's going to provide the drug and also provide teaching on side effects and adverse effects. And this will be really helpful for not only the patient, but also the nurse who is giving the drug. Some legal regulations that you want to be aware of is that Midodrine is approved by the FDA to treat orthostatic hypotension by compression of the blood vessels, and the patient must display a low blood pressure at the provider's discretion, and this is usually less than 90 systolic and 60 diastolic. And then some healthcare policies. You must be taking Midodrine, and it has to be ordered by the physician, and you must, as the nurse, do the 3 checks and 5 writes of the medication before administering it. And the client always has the right to refuse the medication based on prior knowledge. For example, when Guru mentioned that the FDA did consider withdrawing the medication due to some evidence-based trials that they did. And the last NCLEX question that we have, a nurse is teaching a patient about safe dosage and adverse effects of Midodrine. The patient shows an understanding of teaching when the patient says which of the following statements. B is the correct answer, and it is, I will discontinue this medication if I'm experiencing extreme dysuria and a high blood pressure. So dysuria is having trouble having trouble peeing and a high blood pressure because it shouldn't go up to hypertension. It should just treat your hypotension. A is not correct because you can take this medication with or without food. C is not correct because you take this medication orally, so PO. And then D is not correct because this drug is going to increase your blood pressure. And that is our presentation. And here are our references. Thank you so much. Hi, Lauren. I'm Abby. I'm going to be your nurse today. I'm just going to be talking to you about your newest prescribed medication, Midodrine. Are you okay with that?
Yes.
All right, so here's what it looks like. What this is going to do for you is it's going to help with your low blood pressure. Right now, your blood vessels are very dilated, they're very big, and what this is going to do is it's going to constrict them. Is that all right with you?
What does constrict mean?
It's just going to make them tighter, and it's going to help your blood flow to your organs and your heart way better.
Okay. So what is hypotension then?
So hypotension basically means that there's not enough pressure in your blood vessels to get to all your organs and to your heart. So this is just going to help put more pressure on them so that it goes to your heart and your organs way more easily.
Okay.
So with this medication, it's really important for you to talk to your doctor or call your doctor when you experience any of the following side effects. For example, difficulty going to the bathroom and peeing. If you feel like your heart is pounding in your ears, that means that you might have too high of a blood pressure. And so you'll definitely want to call your provider for that, because the medication has really done the opposite of what we want it to do. It's done too much. You also want to call your doctor if you have increased dizziness or faintness, because that can show that it's not working properly.
Well, how often should I be taking this then?
So your provider ordered that you take this every 8 hours, and you're going to be taking 2 tablets every time. So he ordered 10 milligrams, which means 2 5-milligram tablets. You're going to want to take this mostly when you're standing upright. You don't want to take this right before meals or right before bedtime. Approximately less than 4 hours before bedtime, you want to stop taking that, because it can actually cause hypertension, and we don't want that to happen.
And then you said I should take it before like dinner. Does it matter if I take it with food or without food?
You can take it either with food or without food. It doesn't matter. Okay. Are there any questions you have for me about this drug?
Is there any side effects that I should be aware of?
Yeah, actually, some side effects that aren't necessarily serious, but you may want to look out for are goosebumps, nervousness, itchiness of your scalp, fever. Some people may experience hair disease, and a rash.